I mean, the main thing though, the best feedback she could have given was that all of these symptoms that she came with, which are really typical of someone in perimenopause or menopause, she turned around and said that just a few months of being on our therapy and she felt like she got her life back.
Hi guys, welcome back. I'm here today with a fantastic Dr. Kishan, and we are going to be talking about aging and hormonal aging in your 30s, 40s, 50s and beyond using functional hormone replacement. So let me just take you guys on straight over to Dr. Kish. I think he's got some very interesting cases to discuss with us. Is that right?
Basically, it's the lady that came to see you for vaginal rejuvenation with hyaluronic acid injections. She asked you about whether it would improve the hydration of the vagina. And then we had this discussion between us that really, I think she would have benefited more from the hormonal treatments. I've done a sort of a case study, but basically Grace is a lady that saw you first. She came with sort of skin issues really first, and also the vaginal health wasn't the best. And then she also had a chat with you about various other symptoms, including we're not really enjoying sex anymore. I think there was an element of discomfort during sex as well. And I think she thought that coming to see you for the vaginal enhancement with hyaluronic acid would have helped. I mean, no doubt it would, but I think with the addition of hormonal treatments, it was even more of a complete package of treatment. Basically, we saw her then for a hormonal consultation because she also had several other symptoms that I unpacked a little bit more. And Grace was talking about that she had seen her doctor already, her GP, and she'd been complaining for about 1 year with multiple symptoms, particularly sort of night and day sweats, the typical hot flashes of menopause, fogginess of thinking, and she was having difficulty losing weight, even despite really strict exercise regimen. And she had almost cut out carbohydrates in the diet. She had a lot of crying fits and sort of really changeable mood, and her sleep was atrocious. She told me that she couldn't get off to sleep and she couldn't even stay asleep throughout the night. And the other reason she had come to see us was that her face was really showing some signs of accelerated aging. So she had sagging and laxity of the skin here, and she had fine wrinkles and lots of these mimic lines here as well, which obviously we can treat with aesthetic treatments. When we sort of understood more what was happening to her, it was really evident that there was a hormonal underlying cause going on. The other few symptoms she mentioned were frequent migraines and also a difficulty with bladder control, which was really bad when she was laughing, or usually sometimes as well coughing as well. But the thing is, Grace had seen her doctor, had a full consultation with him and even had some blood tests, but he had turned around to her and said that, Grace, you're normal, everything's normal, it's just part of life. And I think, you know, the whole issue was that just from the conversation you and me had with her, we knew she was in perimenopause stage, but unfortunately the help that she was offered in the community wasn't really up to speed. I mean, just Grace highlighted a lot of symptoms that are really common in menopause because of a lack of estrogen, progesterone, and testosterone. And these are the main female sex hormones, as you know. But she talked about hot flashes, this difficulty with weight loss, specifically vaginal dryness, which she came to see you about. And there's these crying fits and snapping at her family and really bad moods. And also this difficulty with bladder control. Now, these symptoms are all indicating that she had low estrogen. And also she described the symptom of having difficulty sleeping, quite low, but she wasn't so depressed actually, Grace, but it's very common in this stage of life. Depression and low mood in particular when you have a loss of progesterone. And the other symptoms of low progesterone are this persistent anxiety or nervousness, particularly with meeting new people, and a fogginess of thinking, some memory issues. Weight gain is also a feature of low progesterone as well. So I think all in all, she had very typical symptoms. As well, she described this urinary incontinence, which is a function of low testosterone as well. She described having problems with sex and sex drive and sort of intimacy in general with her husband, loss of muscle tone. So she lost the physique that she had when she was in her 30s. And that's that's the underlying cause of this is a low testosterone level. So rather than jumping in and doing an external treatment in Grace's situation, we sort of had a big discussion, we had a full consultation, and we decided that we would do some testing, a full screen of hormonal panel. We did a urinary test as well. And not surprisingly, it came back with all of the signs that her hormones were low, that she was firmly in the stage of perimenopause. And based on that, we had a really big discussion about where we could go. And she decided that she wanted to have our support with bioidentical hormones. We're going to have a bit of a chat about what bioidentical hormones really are. But essentially, if you take a hormone that's made in the human body, these hormones that we supply from Lovely Clinic are exactly the same molecular structure, down to every atom, every sort of chain that links the atoms together to the natural hormone. So it has the same beneficial effect on our body that the natural hormones do. So what we did with Grace was we gave her back some of the female sex hormones. And the first one we gave back was transdermal testosterone gel, which you can apply to the skin, as this lady is sort of demonstrating. But in Grace's case, because her issues were mainly vaginal, we asked her to apply it vaginally. And we know that within a few months, she got relief of symptoms. And we know that testosterone gel in particular improves sex drive, it enhances fat loss, and also this socializing as well. And it's a fantastic treatment for preventing and treating urinary incontinence and vaginal atrophy. And I don't think we mentioned vaginal atrophy, but it's related to that treatment that you do with hyaluronic acid, where the vaginal tissues are becoming drier, more fragile, and sometimes the situation becomes so difficult that the vaginal tissues can bleed as well. So testosterone gel, which is what we supplemented Grace with, was a really good tool in our kit box to prevent all of those vaginal problems, as well as the other health symptoms that she mentioned. We also gave her estrogen, and we gave estrogen in a gel form, which she applies all over the length of her arms. And we know that when we give it back in this way, in this bioidentical form, it eliminates a lot of the problems and symptoms that she was discussing and that she complained about to her doctor. So namely, it helps with hot flashes, weight loss, it improves the health of the vagina as well. And it also brings a calmness and a sort of a more equalizing to mood as well. And as well, it improves bladder control. We also gave her a capsule of progesterone to take every night. And this really helps with the symptoms of insomnia and staying asleep. And it also has a very good effect on clear thinking, and it reduces anxiety. But long term, it has a fantastic effect, a really important effect in protecting the breast tissue and the endometrial tissue from cancer. So the endometrium is that lining of the womb, and it's been shown that in menopause, this is one area of the female body that can develop cancer cells. So progesterone helps prevent that as well. Progesterone really has not just symptomatic improvement, it also has long-term effects on health of our patients as well. We carried on with Grace. We had a follow-up call with her about 6 weeks later. She was doing well. And then she came back to clinic 4 months later, and we repeated that round of blood tests, and we repeated the urine test as well. And I was quite happy, because even with just that first initial prescription, she was really happy, and her blood results and her urine results showed that she was in optimal ranges for her hormones, even with some small adjustments. I mean, the main thing though, the best feedback she could have given was that all of these symptoms that she came with, which are really typical of someone in perimenopause or menopause, she turned around and said that just a few months of being on our therapy, and she felt like she got her life back. So I think for me, that was a really good win. And not just in terms of improving her symptoms that she came to see us with, but we know that the hormones that we replenished have long-term health benefits as well, on preventing heart disease, on preventing osteoporosis, Alzheimer's disease, and all sorts of health problems as well.
So Kish, just to interrupt, for the guys at home who maybe are not sure, maybe you could tell us what exactly is a hormone?
So a hormone is a tiny, it's a molecular structure, and it's either a protein or it's derived from cholesterol. essentially it's a messenger, and they're produced, and hormones are produced either in the brain, so either in the pineal gland or the hypothalamus, the pituitary gland, or they're made elsewhere in the body, like the ovaries, the testes, and the adrenal glands. And what they do is they're made in the glands, they're released into the bloodstream, and then they are transported through the body into a target tissue. So that target tissue might be anything. It might be muscle cells, it might be fat cells, but essentially the hormone arrives on the cell and it attaches on a specific site called a receptor. And what happens then is that there's like almost like a lock and a key mechanism where the hormone goes inside the receptor or attaches to the receptor, something clicks into place, and then wonderful things happen in that cell. So in that target tissue cell, various things might happen. It might be that repair happens, regeneration happens, a protein might be synthesized, or metabolism might be increased to burn energy, basically, or burn carbohydrate in that cell. And in women, hormones are really interesting because women get a cyclical, as you know, a rhythmic sort of pattern of hormonal surges and then declines. And that creates that 28-day menstrual cycle to support the release of an egg and its implantation if it gets fertilized, and then even its progression to develop into a fetus if that egg becomes fertilized. So hormones in women have a specific role, and they're even more interesting because they go through the sort of cyclical changes as well. But something happens with age is that, especially in women, there's a decline in the production of the hormones. There's a decline in the receptors, those little locks on the cells of the tissues that the hormones are working on. There's less of those receptors available. And also the receptors themselves become less sensitive to that hormone arriving on the cell and turning it on. So although nature, unfortunately, is declining this process of the production of these hormones, to maintain someone's health, you actually need the hormones to be replenished to a healthy or optimal level. And I'm going to talk to you a little bit about what optimal level is, because I think it's not the same as what you might be expecting when, you know, like Grace did, she went to see her GP and the GP said everything's normal, but normal does not equal optimal when we're prescribing body identical hormones. So the other thing that we notice is that as people age, there's an associated increase in the number of age-related diseases or conditions or just general decline. So it becomes harder to lose weight. There's an increase in cholesterol. There can be a loss of bone mineral. Heart disease increases. You know, the incidence of heart attacks and strokes increases. There's an increase in all forms of cancer, particularly breast cancer, endometrial cancer, and colorectal. There's a decrease in general mood, in sex drive. There's, you know, the key reason people come and see us is for aesthetic dermatology. People around the age of 40 or 40 plus, the skin starts to change, it starts to develop fine lines and wrinkles, and there's a descent of the soft tissues. And also we start to see that the hair loss becomes more evident as well. The hair quality changes. People feel their hair and say it's not the same feel as it was when they were in their 30s or early 40s. And the other things that happen are that there's a loss of general vitality and zest for life. And there tends to be problems with sleeping and being sociable as well. You know, you have this typical image of a slightly bad mood or grumpy old man or a grumpy female patient as time goes by. So these are common features of aging, and in the main, it's usually related to a decline in the hormones or a decline in the efficiency of the receptors working on those target tissues.
Okay, so you've spoken about estrogen, progesterone, and testosterone. Are there any other hormones that we might prescribe for our patient?
There's a whole cascade of how hormones are produced, and there's certain hormones in that tree. I know this is quite confusing, and I know you and me have had our own challenges learning this hormonal pathway, but there's a few select hormones that have been shown to make a big difference in patients' health and in their sort of lust for life or vitality. So I suppose the first one we'll talk about is DHEA, which is that one here. I don't know if you can see my cursor. DHEA is pronounced dihydroepiandrosterone. So not surprisingly, we refer to it as DHEA because it's so much easier to pronounce. But it really is the most abundant hormone in youth. It's probably 20 times in terms of quantity than any other hormone. And it's one that's been associated with general health and preventing some of the age-related decline that we see and that we're used to. When you have a decline in DHEA, what patients notice is that there's generally a loss of muscle, the muscle layer of the skin, underneath the skin. There tends to be an accumulation of fat, particularly around the abdomen. And what's really, really interesting is that the pubic hair and the axillary hair, or the armpit hair, that becomes much more sparse when the DHEA level is low. And also DHEA is related to vaginal dryness and dryness of the eyes as well. And what's just come out, there's a licensed product from America, which is called Intra-Rosa, which is pure DHEA. And that's a vaginal insert, which improves the health and the hydration of the vagina as well. So DHEA is a really, really good hormone to use, providing, once we've done our consultation, once we've done our testing, to make sure that it's low, and then it's very, very straightforward to supplement. I tend not to give it as a vaginal insert unless there's an indication for it, but we give it as a capsule. And you might take 1 or 2 capsules of those in the morning. And it's very, very helpful, not just for boosting energy and as a nice improvement in vitality, but it also helps to act as a building block for the other hormones, such as testosterone and estrogen as well. So that's DHEA. And another, I know there's a hormone that you're interested in, which we've had many discussions about, which is thyroid. Now, thyroid, unlike the other female hormones or the sex hormones, thyroid is not derived from cholesterol. Thyroid is a protein, and it's made in the thyroid gland. And actually, there's different types of thyroid hormone. So there's T1, T2, T3, and T4. And T3 is the hormone that's actually bioactive. So this is the hormone, it's made in much small amounts in the thyroid gland. About 20% of the thyroid hormones is T3 when it's made in the thyroid gland. But that's the one that's the actual hormone that comes along, attaches onto target tissues, and creates magic in the cells. So it regulates metabolism, it regulates circulation, and vascular flow throughout the body. So it's got a really important role in clearing the buildup of waste products from around the body. So the major side effect of having a low T3 level is that you get an accumulation of waste product around the body, a condition that we learned about in medical school called myxedema, which is a direct relation to low thyroid or hypothyroidism. So T3 is the really important hormone in this condition. What tends to happen though is we've got another hormone, another thyroid hormone called T4, and this is thyroxine, or the GP might give you levothyroxine, but T4 is almost like a transport thyroid hormone. And in youth and in health, T4 gets converted in the liver, in the gut, and in other sites of the body, but mainly in the liver, into T3. That's what's supposed to happen. But as time passes, as age continues, that conversion becomes less and less efficient, particularly if you've got other problems with your adrenal glands. And the T4 remains as T4, and you don't get the necessary rise in the level of T3 when your body needs it. So this is the stage where you might have blood results or blood tests that come back as being normal for your thyroid function, but you might have T3, which is nowhere near optimal, and you may be facing all these symptoms of low thyroid. So these symptoms include things like a slow metabolism, a very sluggish circulation, an intolerance to hot or cold weather or temperature. And depression is common, and low thyroid is a major cause of hair loss or hair thinning as well, particularly in female pattern loss. It seems to accelerate the problem. And there's many other symptoms with low thyroid as well, including a puffy face, puffy eyelids, a delay in thinking as well, sort of a fogginess of thinking. fatigue in the morning, and also loss of the outer third of the eyebrow as well. So these
Keratosis pilaris as well.
Ah, really?
Mm.
You learned something. I'm learning. Thank you very much.
I have that. Yeah.
And has it been better since your?
It hasn't actually. No, well, maybe slightly. Maybe slightly.
And are you using any skin treatments for the keratosis?
So I've been trying the Ameliorate, you know, and also another one that was compounded by Roseway, which has got salicylic, niacinamide, hyaluronic acid, and lactic in it. But I actually prefer the Ameliorate, actually.
Ameliorate, okay. Wonderful. Oh, thanks.
Sorry, just on a diversion there.
But this is it, isn't it? There's so much to learn about this topic. Is you realize that every hormone has so many sort of weird and wonderful effects and symptoms when you don't have enough of that hormone, that it's just every day is a school day with you, isn't it? The other hormone I was going to mention was vitamin D and vitamin K2, because there have been quite a lot of studies and association studies to show that if vitamin D is not optimal, then that we don't really see that condition of rickets disease, which is the deficiency disease of vitamin D. But we know that low vitamin D levels are associated with poor bone health. But it's also been associated with an increase in falls and a drop in memory function. And it's also associated with diabetes and neurological disease as well. So vitamin D is a really straightforward test to get done at your GP's office, but it's something we include as part of our package of treatment for hormonal consultation. And it's very, very straightforward to sort out. I mean, we can usually advise our patients to get 20 minutes of sun on their body skin every day if they can. But in general, that's not going to be enough. So we usually need to give a megadose program of vitamin D to get their levels up and to get enough depot vitamin D in the fat stores so that it's easy to maintain, because vitamin D is actually vital for health. I usually give it with vitamin K2, because there's been some studies to show that if you just have vitamin D on its own, you get too much calcium liberated into the circulation, and that might have an effect on on calcium stiffening the arteries and sort of ending up in the lining of the arteries, which is not where you want it. We want the calcium and all the benefits of vitamin D to be in the bones and into the skeleton. So that's why I usually add vitamin K2 into my patient's prescription as well. And lastly, the last hormone I'll mention here, because there's a few others we test for and that we recommend, like melatonin. We sometimes talk about adaptogens for adrenal function, but I think that's a whole other topic, and it's highly specific for when someone comes in for one of our consultations. But pregnenolone. So pregnenolone is a hormone it's on this top. If we look on the cascade, it's just up here, and it's the first sex hormone that's produced after cholesterol. It just takes one metabolic pathway to make it. And pregnenolone's got a really important role in memory. When we find someone who's got this problem of word finding, or they used to be very good at remembering shopping lists, and suddenly they're like, oh, I forgot this, or they talk about trying to remember something, it's on the tip of their tongue and they just can't remember it. That's when that patient often will benefit from this hormone called pregnenolone. And that's quite a straightforward capsule to give in the morning. And it tends to help with fogginess of thinking, memory. And the other wonderful thing about it is that it's a building block, like cholesterol, for all the other hormones as well that we see in this cascade. So it has far-reaching benefits for hormonal health as well. The other thing I was going to mention that we did for Grace was that we did talk to her about nutrition, because she was cutting out her carbohydrates in her diet. She was also very low fat, and she just still had all this stubborn fat around the abdomen particularly, which really improved. I don't know if you remember, but she looked like a different person when she came in to see us, because I think we optimized not just the testosterone, we optimized thyroid as well for her. Mm-hmm. But with her nutrition, we sort of tried to tweak it in such a way that we optimized her food pyramid. So mainly it's a plant-focused diet we recommend, but with plenty of essential fats. So this might include avocados, coconut oil, really good quality meat and saturated fats in meat. But the main focus should be on healthy fats from plants wherever possible, and sort of a limited amount of healthy fruits. And then if you like, maybe one glass of dry red wine, which has been shown to be beneficial in many studies as well. So there is a lot to say about looking at nutrition to help hormonal health. And Dr. Hertog, who's our teacher in hormones, he actually recommends to stay away from refined carbohydrates, which we know as well, processed food, and he really recommends to stay away from dairy, and in particular yogurt, which I thought was interesting. Dr. Hertog says that dairy in particular is so inflammatory, it should be avoided, and it has a detrimental effect on hormonal health.
So Kish, I know some of our patients have got these reservations about taking hormones because they're concerned about the health implications. You know, there was all this stuff in the media a few years ago about the WHI study.
The thing is, you and me are extremely risk averse anyway, and we go through everything with a fine-tooth comb when it comes to recommending any treatments for our patients. WHI study was really an important study because it delineated the difference between supplementing hormones with synthetic, almost alternatives. I don't think it was a real study into hormonal replacement. It was really a study into hormonal substitution with chemical synthetic preparations from drug companies. So the WHI is basically, it stands for the Women's Health Initiative, and it ran from 1990 to 2002. It included, in the end, I think it was 23,347 women. And basically, it was designed to ascertain the benefit versus the risk of a woman in menopause taking synthetic HRT to see whether that would actually have the benefits that the pharmaceutical companies advised. So in the sense, it would prevent all the symptoms of menopause. They proposed it would prevent osteoporosis and cancer. Sadly, the WHI study had to be stopped prematurely because in 2002, largest study ever done on HRT. But what happened was there was a statistical increase and a significant increase in the rate of breast cancer, in heart attack, in clots, including DVT or stroke, and unfortunately, obviously, these were unacceptable complications of taking HRT. The problem is that the media caught the headlines of this study prematurely, and it made front page news, and it unfortunately misrepresented the findings of the study. And the findings of this study also got extrapolated to all forms of hormonal replacement, including bioidentical hormones. So what they used in the study was conjugated equine estrogens, and they used MPA, which is medroxyprogesterone acetate. So these are two synthetic forms of estrogen and progesterone, which have some benefit for menopause, but unfortunately, they have a lot of side effects and complications as well, because they're so drastically different to bioidentical or natural hormones that they can't not have negative effects on the body as well. So unfortunately, that study was poorly designed. It also included a much older population of women as well, who naturally would have been at higher risk for heart disease, for stroke, for breast cancer, and all sorts of other things. The study also showed that there's a higher increase of cancers across the board if the patient is obese, if the person is drinking alcohol, and if they're not taking exercise. So it did come up with some interesting things, and it also firmly established the fact that synthetic hormones have their own hazards and complications and should be used, if they are going to be used, for the minimal time possible. And synthetic hormones are still prescribed by our GPs in the UK, and certainly in the United States, they're very commonly prescribed as well. However, the reason why you and me don't prescribe them is because they have got an inherent risk, and we avoid them at all costs. The other thing that patients ask me as well is, do these hormones cause cancer? And I think that's a really valid concern. And if someone has got a family history of hormone receptor positive cancer, such as breast cancer, then we need to look into a lot further, and that patient may actually not be suitable for hormonal replacement with bioidentical hormones. But in general, if we're talking about a general patient who doesn't have a positive family history or doesn't have this cancer in their own medical history, my feeling is that cancer is a multifactorial disease. We've got, genetics plays a huge part, but also lifestyle factors such as diet, alcohol, Smoking, certainly, exercise and obesity have their own role in whether or not that person will develop a cancer. And certainly the older you are, the longer you live, the higher the chance there is that you may develop a cancer. But the thing that we do in our clinic is that we are constantly monitoring our patients. We have a very firmly designed schedule of tests that have to be done if you want to continue taking hormones safely, so that we catch things early, because we know that the earlier you catch any problems, the prognosis will be much better. Mm-hmm. But in general, the other thing that I find interesting is that bioidentical hormones or natural hormones, if they are in balance, they have a preventative effect on cancer incidence. And since the WHI, there have been many more studies. All the recent studies show a protective effect of being hormonally balanced in terms of preventing cancer. And this is this is common sense as well, because if you look at all young women under the age of 50, the incidence of cancer is much lower than women who are over the age of 50. And progesterone, bioidentical progesterone has been shown to have a protective effect on breast cancer as well, as does testosterone. So if testosterone is given alongside progesterone, it has a synergistic protective effect on breast cancer. So I think these are very reassuring, and I have a lot of confidence in saying that body identical hormone replacement has so many benefits for our patients that, yes, there is a risk in anything that you do, and there's a risk in life that 1 in 3 of us are going to get a cancer or develop cancer cells that may need treatment. But I think being hormonally balanced actually may have so many benefits in all other health aspects in terms of preventing heart disease. So, for example, heart disease is actually the #1 killer of women in the United States, and I believe now in the UK as well. And what they have shown is that if you give estrogen early, so for example, if you catch a woman just early in menopause and you supplement her estrogen levels then, that prevents not only heart disease, but it also prevents Alzheimer's disease as well. So these are huge, because we know that heart disease is the major killer for women and men, of course, as well, right? Mm-hmm. So that's another topic. We'll talk about men later, but we're looking after women today. And I think hormone, for me, I think HRT is not only safe, providing we operate within certain protocols and we're following our patients closely. On balance, I think, it's something that I've recommended for my family and my friends and you as well. We've agreed that it's something that we want to pursue for a long time.
So Kish, you keep mentioning bioidentical hormones. What's exactly the difference between a bioidentical hormone and a synthetic hormone?
Okay, well, if I give a kid an apple and an orange and say, what's the difference between these? It's really obvious to the kid. Yeah, they might both be fruits, but they're wildly different in their color, their look, their smell, and their taste, right? Bioidentical hormones, it's almost like night and day from synthetic hormones. Synthetic hormones, for example, synthetic estrogen is derived from pregnant horses' urine. It's got multiple other horses' estrogens in there, which have completely different effects on the human body. So horses' estrogen is never designed, or should never really be the natural choice for replacing someone who's got a low estrogen level. And similarly, MPA, or medroxyprogesterone acetate, although it's got the word progesterone in there, it's got nothing to do, if you look at the chemical structure or the molecular structure, it's got nothing to do with progesterone. It has the similar effect that it prevents the endometrium or the womb lining from building up too much, but in effect, it's wildly different. So when you give MPA, even as a birth control pill, women will complain about all these complications and side effects. And the reason is that it's wildly different to natural progesterone. Bioidentical hormones, if you look at their chemical structure, they are exactly the same, atom for atom, chemical bond for chemical bond, when you compare to natural hormones that are made by the ovaries in a young female. So that's the real difference. And what we supply at Lovely Clinic is bioidentical hormones.
So Kish, Grace did mention to me that her GP advised her that her blood tests were normal. What different things were you looking for in your investigations?
I suppose this shows us that doctors don't always agree. I mean, you and me have our, our healthy debate sometimes as well. But doctors across the world, they vary quite a lot on how they think medicine should be practiced and really what their targets are for their patients. So a normal reference range usually includes 95% of the population. So if you're taking my blood test for, I don't know, hemoglobin or testosterone, for example, let's make this about us. Then my testosterone might be in the normal level because it includes such a huge portion of the population, but it doesn't mean it's optimal. So when I'm looking at your blood tests, I'm looking for optimal levels. This is completely different. Optimal levels correlate with young and healthy patients' level of a particular hormone. And it also correlates with evidence-based or research-based approach to what level of hormone confers health benefits. So, for example, this might be what level of estrogen protects you against heart disease and protects you against osteoporosis, and what level of progesterone protects you against breast cancer or endometrial cancer. So that for me is an optimal level of a hormone in our patients. And again, like I said, this illustrates that what I might be looking for is different to what your GP might be looking for. The thing, you and me started this journey. I'm trying to remember now, but it's several years that we started our first anti-aging or hormonal conference, and we went to see Dr. Hertog. We've learned from the 4 or 5 of the world authorities on bioidentical hormones. My mentor is Dr. Rouzier in America, and we've learned from Pamela Walton-Smith. Dr. Hertog is amazing. And the thing is, even these world authorities, they have some difference in how they prescribe medicine. So I think what's been interesting for me is to be learning from all of them. And I've kind of found it's not the middle road, it's my own path for how I prescribe. And I am a bit more risk averse than other doctors. So, I do prescribe differently from Dr. Hertog, for example. Yeah. But I think we all find our way. And, the testimonials that are coming back from our patients are really good. And I think the nice thing about Lovely Clinic is that we started off really trying to sort of look at patients and improving them from the outside with their skin, with their hair, doing all sorts of advanced treatments like PRP to regenerate the tissues. But what's been really, really rewarding is that we've focused now on the internal as well as the external approach. And I think that's been the game changer as far as I'm concerned, because I'm noticing the skin improving, the hair regenerating, even just by doing hormonal replacement, not just doing focused treatments on the face or the hair or the scalp.
I think it's the future.
I really think this is precision medicine and where we'll be going. And I hope it becomes conventional. At the moment, conventional medicine isn't really, I don't think it's more like a disease-based model of health. Whereas what I want to do is do a real health focus. And that's why it's my passion now. I want everyone, not just my friends and family, to be healthy and preventing problems for the future. I want everyone to be on the same page. And it's doctors who really have the key to this, because they're the major educators. And when this becomes wider practice, I'll be much happier. Until then, we've got patients who are really happy with what we're doing. I think, yes, you do know this lady. She's someone who comes to see you for skin treatments as well. But she came back with the most amazing testimonial. She's only 35 and she was having difficulties with weight, with premenstrual tension, and with lack of joie de vivre. And she basically she had the full hormonal testing, and her situation was very, very straightforward to implement some changes. And we had this amazing testimonial from her. And she lost weight, and she found her energy levels were a lot better. The best thing is, when I saw her in clinic about 4 months later, I think she came in to see you and I was just there. I remember seeing her and just thought, this is a different person, because she started to date again. She was talking about having an interest in sex. I mean, we have these very intimate conversations with our patients sometimes, but she just turned her life around, didn't she? I think that was a really rewarding mission to meet. Yeah.
Yeah, she really did.
Yeah. And I don't know if this is a talk that we did about menopause. Did you read this comment about this? This isn't one of our patients. This is someone who's had the experience of being in menopause and the horrible side effects of hot flashes and mood changes. I don't know if you read it, but I think it's absolutely hilarious. It's probably the best testimonial to get hormonal balance correct that I've ever seen. And I think she's got such a way with words. I wish she was our patient. She's amazing. So yeah, so that's basically, I mean, I think if our patients at Lovely Clinic are interested, it's something that we are doing more and more of. And it's essentially a consultation that occurs even before you come to the clinic, and then you come and see us, and then we'll have some testing done. And on the back of that, we'll be able to make some changes, some recommendations for diet and for hormonal optimization, if you choose to. And we often work with personal trainers and people like this as well to enhance the whole effect of internal health as well as external health as well. So I think there were some questions that were sent in to us. So let's have a look at those.
So Kish, if somebody's starting hormones, how long do you keep that person on hormones for afterwards?
This is a really interesting question. It's almost a philosophical question, because it's all dependent on how long you want to maintain your health for, if I'm honest, because these are bioidentical hormones. I don't put a time restriction on how long I will prescribe them for, because there's been studies to show that you don't have to stop them like you do with synthetic hormones. Synthetic hormones, you keep the woman, the female patient or the woman on these hormones for the shortest time possible to get over the symptoms, and that's it. That's the limitation of those. With these ones, because they've got a myriad of health benefits, in addition to improving and mitigating menopausal or perimenopausal symptoms, I can keep my patients on them for much, much longer, many, many years into the future. And there's no specific hard line on when I'll stop, as long as the patient is still on board with continuing to take them, because it's still a commitment. Every few years there has to be some testing. We need to be monitoring pelvic health with ultrasounds, and there needs to be regular cervical smears and mammograms as well, if we're going to continue prescribing the hormones. That's the caveat with this treatment, is that we need to keep a close eye on you to make sure that we won't be missing any problems. But having said that, it's almost like, how long do you want to eat healthy for? How long do you want to exercise for? How long do you want to feel good for? So it's a great question. It's just that there's no one size fits all answer. I would say, I mean, as long as you want to continue the health benefits, continue engaging with us and continue taking the hormones. That's what I would say.
So I do have a patient who says that she gets a feeling of very low mood and extreme fatigue. She was asking whether or not that could be a symptom of PMS.
And when you say low mood, did she say, is it like irritability? Is it typical classical PMT symptoms? Do you know?
Depression. Really?
Okay. So frequently, the cause of PMS, so PMS is premenstrual stress, premenstrual tension. Some people have extreme symptoms known as premenstrual dysphoria disorder, PMDD. And classically, the underlying cause is a lack of progesterone. And there are some women who just do not make enough progesterone throughout their menstrual cycle. And this can be a really sad situation. But interestingly, this is one situation which seems to improve almost within one menstrual cycle of taking natural progesterone. So sometimes we might need more than the standard dose of progesterone, but this seems to tackle most of the symptoms, most of the problems with premenstrual stress and low mood or depression, whatever you want to call it. So I would say one thing I would do is we would do a normal hormone consultation, and usually we would replenish low progesterone in this type of patient.
Something some patients also ask is, can these hormones be used as a contraceptive?
Yeah, I wish they would, because that would obviously tick so many more boxes for our patients who are still ovulating and who might be able to get pregnant. Unfortunately, this is a hard no. When our patients, even if we're replacing hormones, patients need to be aware that they need to make sure that they have contraception. Interference of hormonal health that I can probably recommend is the copper IUD. So there's 2 available in the UK, I believe, but this doesn't interfere with the feedback or the intricate patterns that happen in the body in relation to hormonal health. Whereas most of the other contraceptive methods, particularly birth control pill, and even the Mirena coil, the Mirena IUD, these have an impact on hormonal balance. So this is why, patients still have to, they could also have, barrier methods like condoms, but patients have to still take that responsibility until they're firmly in menopause for ensuring that they've got contraception in place.
Okay. Someone on one of the forums asked whether or not you include testing for T3.
Yeah, I mean, this is part of our standard testing. I think we're also looking to include a lot more in our baseline testing, because that will give a lot more value to our patients as well in terms of general health. But T3 is really important to make sure we've got optimal levels. So this is definitely one of the hormones that we check for. We also check for thyroid autoantibodies, and we check for the classical markers of thyroid function, such as TSH and thyroxine as well. So we definitely assess thyroid function as part of our hormonal consultation.
Someone else was actually asking me how often you would do this testing.
Yeah, it's a great question. So, and it's a really important one to know, because it has a cost implication, and I think, and a commitment, as there is a commitment that patients have to make to this program of treatment. In the first year, I generally do 2 rounds of testing, and they're anywhere between 4 to 6 months apart. So say you come to me, I will do blood testing and urine testing at the first appointment, and then 4 to 6, and then you'll get a prescription after that, which will take you into 4 to 6 months. And at that point, usually ask you to come back before 6 months, so that we've got a head start, and then we'll repeat the round of testing then. And usually from that, I can gauge whether I need to change the prescription further without needing to do more testing. After that, usually testing will take place every 2 years, depending on what stage of perimenopause or menopause you're at. And the reason is that once we've got a stable hormonal level for you and that you're in hormonal balance, it's not so necessary to keep testing and testing. And the problem is, testing is the really expensive part of our hormonal treatment. Wherever possible, I try to keep the prescriptions limited to licensed prescriptions, and only when I need to, I'll use compounded prescriptions, so that this way I keep the budget for your monthly prescriptions as low as possible. If your costs for the hormones and the testing is so sky high, then our patients just won't be able to keep continuing with it, and the cost becomes too prohibitive. So I'm very mindful of that. I think once we've done our testing, once I've got you in balance, I want the cheapest and yet the best options for treatment available for you. A lot of people are not aware that even within the health service, and I'm really proud of the NHS, I think it's fantastic. It's the best health service in the world, it's given freely. The amazing thing is that women can get bioidentical hormones through the health service. There are licensed products that you can get from your pharmacy, which are bioidentical hormones. And in the main, I also prescribe these as well. I just prescribe them slightly differently to how other GPs or other doctors might prescribe it. And the other difference is that I test for, and I'm aiming for optimal levels of the hormones once you start taking those. So our approach is different, but you can get bioidentical hormones through the health service, but you just won't get the same, service. You won't get the same program of treatment. I don't want to say too much more, but it's just a very different approach. And for example, I'll tell you, I'm a member of the British Menopause Society. They advocate that you should not test patients for hormonal levels. And that's not something I personally agree with. I think
that's crazy.
Yeah, I mean, I think if for example, if I know an estrogen level in your body that is going to protect you against osteoporosis and protect your heart health and brain function, I want that optimal level for you. And how am I going to know that unless I test?
Mm-hmm.
Okay, I agree. There are difficulties surrounding testing because testing depends, hormones are produced in a pulsatile manner. They're basic, you get surges of hormones being made. So, all blood tests aren't going to catch the perfect level of that hormone. However, that's why we also use urine tests as well to sort of make sure that we've got the best, bigger picture, and then we can advise you appropriately. Otherwise, we're going to miss a trick. But basically, a licensed product is something that's made by a pharmaceutical company, and it's mass produced, and there's fantastically stringent levels of quality control in the production of making that product. Sometimes you'll have a hormonal product, for example, or any pharmaceutical that might not be right for you. So it might be that you have an allergy to one of the gel ingredients. You might not be able to tolerate the dosage of progesterone, for example, that's in that capsule that's made. Or you might have some reaction to another element of that pharmaceutical product. Or it might be that that hormone just simply isn't available. So for example, testosterone, in the format, in the dose that I want to give it to my female patients, and in the delivery, so I like it to be applied on the skin and sometimes in the vagina, it's not available as a licensed product. So in these situations where I need to have something that's almost bespoke, something that's tailor-made to you, I have to go to a compounding pharmacy. Now there's about 4 or 5 in the country. There's 2 that I use, which have got fantastic reputation, and they have their own very stringent quality control and operating protocols. They will formulate a product that's specifically made to you, made to your prescription. So say in this situation, I want to make testosterone at a very low level for you. They can make it in your name. It doesn't have the same quality of preservatives. It doesn't have the same shelf life, but it often will have enough for the prescription that I give you. And it really plugs that hole in where the licensed products can't fill. The disadvantage is that these compounded products tend to be more expensive. I mean, sometimes double, sometimes triple the cost of the licensed product. So as I said, wherever possible, I try to prescribe licensed products so that it's much more affordable for you. However, there are situations where I have to have compounded options as well.
I guess you're paying for the expertise of the pharmacist.
They have to spend a lot of time in these special hood-covered laboratories creating a product directly for you. I mean, one example is in America, and it's available in the UK as well, I believe, but it's a progesterone capsule called Prometrium. A Prometrium contains peanut oil. And how many people do you and me personally know that have nut allergies that can't take that product? So for that reason, then I would have a progesterone capsule made, sometimes in the same dose exactly, but just without the allergenic potential of that licensed product. But yeah, I mean, we're paying for the pharmacist's time, their expertise, and also the bespoke nature of making something specifically for you.
So you mentioned it earlier, actually, Kish, but what is your take on the Mirena coil?
Oh, okay. Interesting. So Mirena is a intrauterine device or coil which contains medroxyprogesterone acetate, MPA. And it releases small amounts, it's supposed to be secreted just in the confines of the uterus. However, the human body is much more complicated. We've got blood flowing around and vessels transporting chemicals all over the body. And no doubt there's some of this synthetic medroxyprogesterone acetate being delivered elsewhere in the body. The difficulty we have is that there's very, very difficult to determine how much is circulating throughout the body. We expect it, I mean, from whatever research, whatever minimal research is out there, we expect it to be very, very low. However, it may still have an impact on how much natural progesterone you may be able to make. So Mirena is probably, in terms of synthetic hormones, it's definitely still a synthetic hormone, but because it's a device and it's largely restricted to the uterus, it's the lesser of all the evils when it comes to synthetic hormones. And it's a very good strategy for reducing menstrual flow, and it's also a very reliable form of contraception. So it is a very widely accepted, very popular form of contraception. And often women who are in their 40s or approaching menopause will have the Mirena inserted for contraception, but also to prevent any problems of the endometrium building up. And that build-up of the endometrium is what causes, it causes the potential for cancer cells to develop. So Mirena coil is a good option. We have a very, very experienced gynecologist colleague who inserts Mirena coils for us if your GP doesn't provide that service. But it's not, I've got to be honest, because it's still a synthetic progesterone, it's not answering that need for progesterone in the body. Because there's progesterone receptors in the breast, in the brain, all over the body actually. So we need progesterone, we still need bioidentical progesterone levels to be optimal. So I would probably say, if I've got a woman who for whatever reason she wants to continue using the Mirena coil, she can. And then we will obviously still be doing the testing to make sure that progesterone, estrogen levels are optimal. And if they're not, then we can still supplement them correctly.
So you mentioned earlier the WHI study and the negatives around synthetic hormones. Are they still available?
Oh yeah, absolutely. I mean, this is the power, this is the lobbying power and the influence of the big pharmaceutical companies have so much influence over doctors, over patients, over medical schools that Provera and Premarin or Prempac are still widely prescribed. And they are the synthetic hormones that were studied in the WHI, which is, it's really interesting to me that they're still available. But the fact is that they're still much cheaper. They're still a cheap pharmaceutical option, and they are reliable. They mitigate many of the menopausal symptoms. The only problem is that you can only use them for a very, very limited time, and most doctors will restrict the prescription of them just to allow for menopausal symptoms. So in conventional medicine, even if you have a doctor who's happy to prescribe you synthetic hormone replacement, it will be for the shortest time for the maximum benefit against menopausal symptoms. So it's not, they're not going to offer the same benefits in promoting health for the future and preventing age-related decline. You know, we can't really say, or we shouldn't say, that any of our treatments are anti-aging, because aging is a part of life. What we really want to do is we want to optimize aging and be healthy. You know, we don't want to just live longer. We want to be living well. We want to be living happily and living as healthy as possible. And we can achieve that with nutrition, correct mindset, and absolutely bioidentical hormones have got a huge role to play as well. But I think synthetic hormones, they've had their place in history. I personally don't ever want to prescribe them. I never will. I don't think I ever will prescribe them. But yes, they still are available.
So thanks so much, Kish, for doing the presentation for us today. It was really, really fascinating and illuminating. And I'm sure that there are going to be people at home who are thinking, my God, that sounds amazing. I want to get myself a bit of that. So if you do want to get involved and have a conversation with us about maybe having a look at your hormonal levels, then give us a call. It is a little bit different than having aesthetic treatments because there are more appointments and a bit more faff, if you like, involved in doing it. But speaking as somebody who has been on that journey myself, I would say that it's definitely 100% worth it because you cannot put a price on the way that you feel.
Yeah, you know, I was going to say, even if it's just to start the conversation, even if it's something you're thinking about, it's like we were saying before, it's moving away from this disease focused model and really trying to get a health focus in our lives again. You know, it's so easy just to say, I'll put it off till later. You know, this is probably the best. We've had so much time on our hands recently. This is probably the time to start thinking about where might I be able to optimize things, you know, do some biohacking, whatever you want to call it, but we can start the conversation at least.
So we spoke today about perimenopause. I'm hoping that we're going to film one of these for men at some point in the near future.
Why not?
Yeah. So thanks very much for joining us, and big hugs. I'll see you soon.
Bye, love.